I got involved in the Health Ambassadors Program by accident. I came to the Southeast Side meeting for another issue. And while I was there, I heard about the Health Ambassadors and said, oh, this sounds good. I sat in that meeting, learned that they were working with issues of diabetes in the community and issues of cardiovascular diseases. And I said, because I had had a very traumatic experience in 2007, I thought this could be helpful to me. I mentioned that to my pastor at Pilgrim, Reverend Hudson, and said, maybe this is something I can do. And he said, yes, okay. Why don't you come to the meetings, get the information, bring the information back, and we can start setting up there in the church on Wednesday evenings our own Health Ambassadors Program. And that's what has been a wonderful experience for me.
We got involved with the Ambassador Program because we thought it was an excellent opportunity to teach and educate not only the people in our church, but outside of the church, our community, to educate them about the different diseases that are out there, how to live a better, healthy, enjoyable life.
And I became involved because I noticed in the church there was such a wide range of age groups, but in all the age groups they were all interested in working out and doing some type of fitness program. So we became involved so that we were better able to help them do that.
I was at church one Sunday and Miss Carpenter mentioned to me that they were going to be starting a new program, the Health Ambassadors Program, and it was going to be being held at our church every third or fourth Wednesday of the month. So she asked me to come out and listen and learn and be a part of it. So I took the time out from class. I go to school. I took the time out. I came out and I started listening, and they were talking about some things that were of concern to me because diabetes is a part of my family.
You know, the Health Ambassadors Program has been very helpful to me in communicating with people around me, my family, my friends, and sometimes just strangers on the street. I never wanted to complain about my health issue. I wanted to give information about health issues. And coming to the Health Ambassadors workshops, I'm learning the theories behind things, the words to use to describe what's actually going on or has gone on in my life. And when I speak to people who walk up to me, or I walk up to and say, hey, did you know? Or guess what I'm experiencing now? I then can give them factual information. I look at my family and realize for years we've been eating incorrectly, preparing our foods incorrectly, that we have got to make some changes about the fat in our food, some changes about the sugar in our food, some changes about the salt in our food. I come from a family of women who have been seriously affected by diabetes, my mothers, my aunts, and my uncles. And I looked at them for years and never thought, this is not going to be my problem. But I understand it is a family problem. It is a genetic problem, and it's not just mine, but it's also my children. I listen at church now, and I hear some women talking about some of the issues that they have with their breathing or some issues that they have with their diabetes. And I know that it's important that they get good information and that they be somehow encouraged to make a relationship between what we read in the scriptures about good health and our bodies in Christ and spirit and what we know to be true about what we're experiencing.
The Health Ambassador Program has helped me to understand the complications that come with these different diseases such as diabetes, high blood pressure, and cholesterol. It's made me understand and to give out information to my mom who has diabetes, and just to educate us even more and making this a better, healthier way for her to live, as well as anyone else that I know that has these different diseases as well.
And the Health Ambassador Program has helped me because it opened up my eyes to see how important diet is in conjunction with exercise, and how much more of a healthy person you can be by combining diet and fitness.
Well, the last time that we were at the Health Ambassadors Program at Pilgrim Pilgrim Baptist Church, we had salmon, and my family, my daughter and her husband, they're big on salmon, and I took it home and I showed them, and my granddaughter was telling them how good it was, and she was real excited about it, and she was telling them about how they discussed the cardiovascular system and how we went over the entire body and the different systems and how she was able to contribute. And my daughter said, "You did all that?" She said, "Yeah." And she said, "Mama, everybody get involved, everybody." So I've been sharing with my immediate family because that's where my concern is. I also have a father that's almost 80 years old, and I have a sister that is taking care of him. And I was sharing some things because he likes salmon, and he wants his fried all the time. But I showed her this recipe, and she employed and used it on him, and he enjoyed it also. So I'm trying to, I'm not as busy going out in the community. I'm trying to work with my own family because we've eaten wrong for a long time. So if I can kind of reel them in, then after I get them reeled in, then I can go out with the rest and work in the community. But right now, as a major project, I'm working within my family.
You know, I've been using the information that I've learned from the Health Ambassadors workshops, first of all, in the church itself. I found myself walking around inviting people to come to our Wednesday night sessions. Come and hear what we're talking about. Come and try the sample food. The church itself sometimes has events going on, and those events sometimes require that we prepare meals for people. And I will say to the cooks or to the catering service, think about what you're preparing in terms of the health of the membership. And I'm noticing some changes in the food that's being prepared for the pastor and family and for the church members. And I think they're beginning to understand what we're trying to say. We're not trying to tell you how to do your job. We're trying to tell you, think about all of us being healthy and healthier than we are. I have in my family, I have a son who is very much into health food and health food kinds of issues. And I've talked to him about what we're doing with the Health Ambassadors program. And he has created a line or a section in his newsletter where I can put information in it every month about some of the Health Ambassadors things that we're talking about. And if I can remember, I'll bring one of those newspapers to the next meeting. Just people in general, my husband, my sister-in-law, I talk to them about what we do at the meetings and how they should prepare their foods and how they should think about their health, particularly since all of us are getting older, how we need to be able to have good experiences in our life as old age. We should not be on walking canes. We should not be missing limbs. We should not be taking 15 medications every day. We can do some things about all of that by looking at how we can live healthier and behave healthier in our preparations of food. This has been a very good experience for me. This has been a good set of workshops, and I think they can hold on to me for a year now. And this is a good thing, I think.
I have used the Health Ambassador program to help others with exercise, showing them the proper way of toning, of stretching, the importance of cardio, just battling obesity because it's on the outrise, and just to encourage and motivate these people, and they just feel so happy that I'm there to help them, and I'm happy as well.
I've used the Health Ambassador program at my local YMCA, where there's quite a few senior citizens there, and I was able to give them some pointers on their diet, which in conjunction with their exercise has helped them greatly in relieving a lot of the stress and pains that they've been having.
The way the Health Ambassadors program has helped me and my family with our eating and changing of some of the bad habits that we have been using for years and years. I showed them some of the menu things that we have eaten at the program, and we shared cooking some of the recipes that were given to us, and they enjoyed them.